You ready?
Ready.
Room check.
Oh.
No cheating, no nothing. Except for me and my stepfather and my dogs. Okay, so my scenario is George Miller is a 62-year-old Caucasian male who was discharged after being hospitalized for 10 days with acute respiratory failure secondary to chronic obstructive pulmonary disease known as COPD. This is the nurse's third weekly visit with Mr. Miller. He tells the nurse that he is feeling great and that he was able to walk outside on his patio for a few minutes today without his oxygen. He is using oxygen at 2 liters per minute when he exercises and PRN for shortness of breath. He reports a chronic cough as usual, but denies any speed on production. He says that he still is having difficulty getting a good cough because I don't have any energy anymore. The abnormal findings that I found is acute respiratory failure, secondary to COPD, oxygen on 2 liters, chronic cough, difficulty a good cough related to having no energy anymore. So the assessment that I chose was the central vessel assessment. And the first thing I'm going to do is I'm going to wash my hands. Gonna knock, introduce myself. Hi, my name is Kirsten. I'm a nursing hack student here. I'm going to be assessing you today. Can you please tell me your name and date of birth?
Yes. Nicholas Hull, May 16th, 1969.
I'm gonna verify that with his wristband or the MAR. And you can go to the phone now.
Next you go.
Okay, good. All right, so the first thing I'm going to do is provide privacy, shutting the door, pulling the curtain, and I'm going to ask you, do you have any allergies?
Nitroglycerin.
Okay, so before we go ahead and get started on the assessment, I'm going to ask you a few questions. So, when did this all begin?
2 weeks ago.
2 weeks ago, and how long does it last?
A minute.
A minute until you get relief, and how often is that minute? Is it like a minute and then it comes back within 30 minutes?
Yes.
Okay, and where is the location?
The cough?
Yeah, the cough is in your throat.
Yeah, it's a tickly cough, like coughing tickly.
Okay, and the characteristics, you said it's tickling. Anything else?
I can't clear it when I try and cough.
Okay.
I don't have the energy.
Okay, and any aggravating, anything that aggravates it?
No, I just have COPD.
And what relieves it?
Coughing, I don't know. Nothing much. Nothing really.
Have you done any over-the-counter treatments?
No, I have not.
No?
No.
And if you had to rate this as 0 being no pain or not affecting your life at all, and 10 being the worst, how bad is this affecting your everyday life?
A 3.
A 3. Okay. So I'm going to go ahead and do the assessment at this point. I'm going to go ahead and check his jugular veins. So I'm going to check his sternomastoid muscle, which is over here, and his jugular vein, which is going to go across from that. I'm going to take my pen light and I'm going to shine it, and I'm going to make sure that it is not distended, that it is either flat or non-visible, and as you can see that you can't even see it on this side, so that's a normal finding. I'm going to go over to this side, and I'm going to go ahead and turn your neck that way, check for the sternomastoid muscle, the jugular vein, and I'm going to check his jugular vein and make sure that it is not distended, which you see it is not, and it is not even flat, it's not visible, so that's a normal finding. Next, I'm going to check the his arteries, and I'm going to wipe my stethoscope off.
My carotid artery?
Carotid arteries, yeah. Couldn't pronounce it right. I'm going to warm it for 5 to 10 seconds. And I'm going to have my patient this whole time, like you see here, they should be sitting up at least 45 degrees from the beginning of the assessment. I'm going to check 3 locations of this. So it's going to be right below their jaw, their mid-clavicular line, and right above their collarbone. When I put my stethoscope up, I'm going to ask you to inhale and exhale and hold your breath on each location so I can listen. I'm going to put the bell up. Go ahead and inhale. Exhale. Inhale. Exhale. Inhale. Exhale. And there was no bruise found on this side, so that means that's normal finding. I'm going to go ahead and check this side. Same thing. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. And no bruise found on that. So my patient has normal finding. Okay, so next I'm going to feel his arteries. I'm going to make sure that I only use my pointer finger and my middle finger. And I'm only going to do one side at a time. I don't want my patient passing out. And I'm going to make sure that I'm going to check for the trachea and the muscle here. And I'm going to go in between. So I'll put it here. And that side is a +2, which is a normal finding. I'm going to check this side. Which is a +2, which is a normal finding. So at that note, my patient has no abnormal findings at this moment. I'm going to go ahead and do a room check. Show that there's no notes. Just my dogs. And my scenario. And then my stepfather. And that's it.